हेलो अस्सलाम वालेकुम। नाजिया बाजी, मेरे को को होस्ट बनाना प्लीज।
क्या बोल रहे थे था? वालेकुम अस्सलाम।
को होस्ट।
हाँ, मैं बना रही हूँ मेहताब बाजी को होस्ट। मैं अभी लीव करूंगी। ठीक है? हो गया, मैंने यूट्यूब लाइव कर दिया है।
Take the notes. We have the notes for
Thomas cars. Good afternoon to all. We will start with our session, inshallah. نحمده ونصلي على رسوله الكريم أما بعد فأعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم Assalamu alaikum wa rahmatullahi wa barakatuh. IMA Ladies Wing और फोरम ऑफ इंडियन डॉक्टर्स कुवैत के जानिब से मैं हिना परकार आप सबका तहे दिल से इस्तकबाल करती हूँ। किसी ने सच ही कहा है, सेहत वो न्यामत है जिसका शुक्र इंसान बहुत ही कम करता है। आज इस हेल्थ अवेयरनेस सेशन के जरिए हम इस न्यामत की तरफ अपनी जिम्मेदारियों को समझने की कोशिश करेंगे। सेशन की शुरुआत हम तिलावत कुरान से करेंगे, जिसके लिए मैं दावत देना चाहूंगी बहन नौशबा को कि वो हमारे लिए सूरह अल आराफ की आयत 31 to 35 की तिलावत और तर्जुमा पेश करें।
अस्सलाम वालेकुम वरहमतुल्लाहि वबरकातुहू। अऊज़ु बिल्लाहि मिनश
बहन नौशबा
शैतानिर रजीम। बिस्मिल्लाहिर रहमानिर रहीम।
बहन नौशबा आपकी आवाज नहीं आ रही है।
जी मेरी आवाज नहीं आ रही है?
आ रही है, आ रही है, मैं सुन रही हूँ।
जी
I can hear. I can hear.
अऊज़ु बिल्लाहि मिनश शैतानिर रजीम। बिस्मिल्लाहिर्रहमानिर्रहीम। या बनी आदम खुज़ू ज़ीनतकुम इंद कुल्लि मस्जिदिन वकुलू वशरबू वला तुस्रिफू इन्नहु ला युहिब्बुल मुस्रिफीन। कुल मन हर्रम ज़ीनतल्लाहि अल्लती अख़रज लिइबादिही वत्तय्यिबाति मिनर रिज़्क़। कुल हिया लिल्लज़ीना आमनू फिल हयातिद दुनिया खालिसतन यौमल क़ियामह कज़ालिक नुफ़स्सिलुल आयाति लिक़ौमिन यअलमून। कुल इन्नमा हर्रम रब्बियल फ़वाहिश मा ظهر منها وما بطن والإثم والبغي بغير الحق وأن تشركوا بالله ما لم ينزل به سلطانا وأن تقولوا على الله ما لا يعلمون. ولكل أمة أجل فإذا جاء أجلهم لا يستأخرون ساعة ولا تستقدمون. يا بني آدم إما رسل منكم يقصون رسل منكم يقصون عليكم آياتي فمن اتقى وأصلح فلا خوف عليهم ولا هم يحزنون۔ ترجمہ ہے، اے بنی آدم، ہر عبادات کے موقع پر اپنی زینت سے آراستہ رہو اور کھاؤ پیو اور حد سے تجاوز نہ کرو۔ اللہ حد سے بڑھنے والوں کو پسند نہیں کرتا۔ اے محمد صلی اللہ علیہ وسلم، ان سے کہو، کس نے اللہ کی اس زینت کو حرام کر دیا جسے اللہ نے اپنے بندوں کے لیے نکالا تھا، اور کس نے اللہ کی بخشی ہوئی پاک چیزیں ممنوع کر دیں؟ کہو، یہ ساری چیزیں دنیا کی زندگی میں بھی ایمان لانے والوں کے لیے ہیں، اور قیامت کے روز تو خالصتاً انہی کے لیے ہوں گی۔ اس طرح ہم اپنی باتیں صاف صاف بیان کرتے ہیں ان لوگوں کے لیے جو علم رکھنے والے ہیں۔ اے محمد صلی اللہ علیہ وسلم، ان سے کہو کہ میرے رب نے جو چیزیں حرام کی ہیں وہ تو یہ ہیں، بے شرمی کے کام، خواہ کھلے ہوں یا چھپے، اور گناہ اور حق کے خلاف زیادتی، اور یہ کہ اللہ کے ساتھ تم کسی کو شریک کرو جس کے لیے اس نے کوئی سند نازل نہیں کی، اور یہ کہ اللہ کے نام پر کوئی ایسی بات کہو جس کے متعلق تمہیں علم نہ ہو کہ وہ حقیقت میں اسی نے فرمائی ہے۔ ہر قوم کے لیے مہلت کی ایک مدت مقرر ہے، پھر جب کسی قوم کی مدت آن پوری ہوتی ہے تو ایک گھڑی بھر کی تاخیر اور تقدیم نہیں کی جاتی، اور یہ بات اللہ نے آغاز تخلیق ہی میں صاف فرما دی تھی کہ اے نبی آدم، یاد رکھو اگر تمہارے پاس خود تم ہی میں سے ایسے رسول آئیں جو تمہیں میری آیات سنا رہے ہوں، تو جو کوئی نافرمانی سے بچے گا اور اپنے رویے کی اصلاح کر لے گا اس کے لیے کسی خوف اور رنج کا موقع نہیں ہے۔ وما علینا الا البلاغ۔ السلام علیکم ورحمۃ اللہ وبرکاتہ۔
جزاک اللہ خیر بہن نوشبہ۔ اب میں دعوت دینا چاہوں گی ہمارے IMA لیڈیز ونگ کے احباب کو جو کئی سالوں سے ہمارے جماعت کا حصہ رہی ہیں۔ انہوں نے بیچلر آف ہومیوپیتھک میڈیسن اینڈ سرجری میں اپنی تعلیم مکمل کی ہے اور سرٹیفکیٹ کورس ان گائناکولوجی اینڈ آبسٹریٹکس پربھانی مہاراشٹرا سے کی ہے۔ اب ہمارے ساتھ جڑے گی ابو حلیفہ کی نائب ناظمہ ڈاکٹر ہاجرہ سید، جو صحت مند زندگی کے سنہرے اصول پر تذکیر پیش کرے گی۔ ڈاکٹر ہاجرہ۔
جی، نحمد و نصلی علی رسولہ الکریم، اما بعد، اعوذ باللہ من الشیطان الرجیم، بسم اللہ الرحمن الرحیم، رب اشرح لی صدری ویسر لی امری واحلل عقدۃ من لسانی یفقہوا قولی۔ السلام علیکم ورحمۃ اللہ وبرکاتہ۔ Am I audible?
Yes, you are audible.
اوکے۔ محترم بہنوں، میں آج آپ سب کا IMA لیڈیز ونگ کی جانب سے اس سینٹرل ہیلتھ اویئرنیس سیشن میں خیر مقدم کرتی ہوں۔ اہلاً و سہلاً۔ آج میں آپ کے سامنے ایک بہت اہم اور ضروری موضوع پر بات کروں گی، اور وہ ہے صحت مند زندگی کے سنہرے اصول اسلام کی روشنی میں، یعنی گولڈن رولز آف ہیلدی لائف ان اسلامز پرسپیکٹیو۔ اکثر جب صحت کا ذکر ہوتا ہے تو ہم صرف ڈاکٹر، دوا اور ہاسپٹل کے بارے میں سوچتے ہیں، لیکن اسلام نے صحت کا تصور بہت واضح طور دیا ہے۔ اسلام صرف جسمانی صحت کی بات نہیں کرتا بلکہ روحانی، ذہنی اور سماجی صحت کی بھی تعلیم دیتا ہے۔ اللہ سبحانہ وتعالیٰ نے انسان کو بہت ہی خوبصورت اور بہترین انداز میں پیدا کیا، جس کا ذکر قرآن کے سورہ نمبر 95 3 آیت نمبر 4 میں اس طرح کیا گیا ہے، لَقَدْ خَلَقْنَا الْإِنسَانَ فِي أَحْسَنِ تَقْوِيمٍ، جس کا ترجمہ ہے یقیناً ہم نے انسان کو بہترین سانچے میں پیدا کیا۔ جب اللہ سبحانہ و تعالیٰ نے ہمیں اتنی خوبصورت نعمت دی ہے تو اس جسم کی حفاظت کرنا بھی ہماری ذمہ داری ہے۔ اللہ سبحانہ و تعالیٰ نے ہمیں جو سب سے قیمتی نعمت دی ہے اس میں سے ایک ہماری صحت ہے۔ اکثر ہم اس نعمت کی قدر اس وقت کرتے ہیں جب ہم بیمار ہو جاتے ہیں، اسی لیے ہمیں صحت کی حفاظت کرنی چاہیے، کیونکہ صحت مند انسان ہی اللہ کی عبادت بھی بہتر طریقے سے کر سکتا ہے اور اپنی ذمہ داریاں بھی اچھی طرح سے نبھا سکتا ہے۔ ہم اکثر پیسہ، گھر اور گاڑیوں کو بڑی نعمتیں سمجھتے ہیں، لیکن نبی صلی اللہ علیہ وسلم نے بتایا کہ صحت سب سے بڑی نعمتوں میں سے ایک ہے۔ اسی لیے ہمارے پیارے نبی صلی اللہ علیہ وسلم نے فرمایا، دو نعمتیں ایسی ہیں جن میں بہت سے لوگ دھوکے میں ہیں، صحت اور فرصت۔ یعنی صحت اللہ سبحانہ و تعالیٰ کی بہت بڑی نعمت ہے جس کا حساب بھی ہوگا۔ اسلام صرف عبادت کا دین نہیں بلکہ پوری زندگی گزارنے کا طریقہ سکھاتا ہے۔ ہمارے دین نے صاف صفائی، غذا، نیند، ایکسرسائز اور مینٹل ہیلتھ تک ہر چیز کی رہنمائی دی ہے۔ تو آئیے جانتے ہیں کیا ہے وہ سنہرے اصول جنہیں اپنا کر ہم صحت مند زندگی گزار سکتے ہیں۔ تو سب سے پہلا اصول ہے صفائی، یعنی ہائیجین۔ اسلام میں صفائی کو بہت اہمیت دی گئی ہے۔ جیسے وضو ہم دن میں کئی مرتبہ کرتے ہیں، قرآن کی تلاوت کرنے سے پہلے، نماز کے لیے۔ اس سے صرف روحانی پاکیزگی نہیں بلکہ جسمانی صفائی بھی ہوتی ہے۔ ساتھ ہی غسل کرنا یعنی باتھنگ کرنا، مسواک کرنا جو ہمارے اورل ہیلتھ کے لیے بہت بہترین ہائیجین ہے، ناخن کاٹنا، بال صاف کرنا اور کپڑوں کی صفائی سب سننا ہے۔ رسول اللہ صلی اللہ علیہ وسلم نے فرمایا، الطہور شطر الایمان، یعنی پاکیزگی ایمان کا آدھا حصہ ہے۔ سوچئے جس دین نے صفائی کو ایمان کا حصہ قرار دیا ہو، اس دین کے ماننے والوں کو کتنا صاف ستھرا ہونا چاہیے۔ آج سائنس بھی یہی کہتی ہے کہ ہاتھ دھونا، صاف ستھرا کھانا اور پرسنل ہائیجین بہت سی بیماریوں سے بچاتی ہے۔ اسلام نے ہمیں یہ تعلیمات 1400 سال پہلے ہی دے دی تھی۔ اس کے ساتھ ساتھ ماحول کی صفائی بھی ضروری ہے۔ اسلام صرف اپنی جسمانی صفائی ہی نہیں بلکہ اپنے گھر، محلہ، مسجد، روڈ سب کی صفائی کی تعلیم دیتا ہے۔ رسول صلی اللہ علیہ وسلم نے فرمایا، راستے سے تکلیف دینے والی چیز کو ہٹانا بھی صدقہ ہے۔ سبحان اللہ۔ تو آئیے پہلے اصول ہم نے جان لیا اور وہ تھی صفائی۔ اب ہے دوسرا اصول جو ہے متوازن غذا یعنی بیلنس ڈائٹ۔ اللہ سبحانہ و تعالیٰ قرآن میں فرماتے ہیں، سورہ بقرہ آیت نمبر 168 میں، یا ایھا الناس کلوا مما فی الارض حلالا طیبا، یعنی اے لوگوں زمین میں جو حلال اور پاک چیزیں ہیں اس میں سے کھاؤ۔ یہاں صرف حلال ہی نہیں بلکہ طیب یعنی پاک، صاف اور صحت مند غذا کھانے کا حکم دیا گیا ہے۔ اس لیے ہمیں تازہ کھانا کھانا چاہیے، صاف ستھرا کھانا چاہیے، گندا یا خراب کھانے سے بچنا چاہیے۔ اسلام حلال کھانے کے ساتھ پاکیزگی اور صحت کو بھی اہمیت دیتا ہے۔ کھانے میں اعتدال یعنی ماڈریشن کی بھی بہت زیادہ ضرورت ہے۔ آج بہت سی بیماریاں کس وجہ سے ہو رہی ہیں؟ اوور ایٹنگ، جنک فوڈ، فزی ڈرنکس، میٹھی چیزیں، ایکسرسائز کی کمی۔ اللہ تعالیٰ فرماتے ہیں سورہ الاعراف میں آیت نمبر 31 میں، جو ابھی ہم نے سنی، وَكُلُوا وَاشْرَبُوا وَلَا تُسْرِفُوا إِنَّهُ لَا يُحِبُّ الْمُسْرِفِينَ، جس کا ترجمہ ہے کھاؤ اور پیو لیکن حد سے نہ بڑھو، بے شک اللہ حد سے بڑھنے والوں کو پسند نہیں کرتا۔ سبحان اللہ، کتنا خوبصورت اصول ہے۔ اسلام کبھی بھوکا رہنے کو بھی حکم نہیں دیتا اور نہ ہی حد سے زیادہ کھانے کی اجازت دیتا ہے۔ آئیے
افو तेरे पास यूट्यूब है ना? यूट्यूब पे
جی
स्ट्रीम लाइव हो रहा है, मुझे सुनने का है ये, तो यूट्यूब पे लाइव इधर
کین آئی کنٹینیو؟
یس پلیز۔
اوکے، تو آئیے اب دیکھتے ہیں کہ کھانا کھانے کا سننا طریقہ جو ہمارے پیارے نبی صلی اللہ علیہ وسلم نے بتایا ہے وہ کیا ہے۔ نبی کریم صلی اللہ علیہ وسلم نے فرمایا، انسان نے اپنے سے برا کوئی برتن نہیں، اپنے پیٹ سے برا کوئی برتن نہیں بھرا، آدم کے بیٹے کے لیے کچھ لقمے ہی کافی ہے۔ اگر زیادہ کھانا ضروری ہو تو ایک حصہ کھانے کے لیے، ایک حصہ پانی کے لیے اور ایک حصہ سانس کے لیے رکھیں۔ یہ ترمذی کی حدیث ہے 2380۔ یعنی ہمیں ہمارے پیٹ کا 1/3 حصہ یعنی 1/3 پارٹ کھانے سے، 1/3 حصہ پانی سے اور 1/3 حصہ ہوا کے لیے رکھنا چاہیے۔ یہ صرف سننا ہی نہیں بلکہ صحت کا بہترین فارمولہ ہے۔ ڈاکٹرز کہتے ہیں کہ اوور ایٹنگ سے ڈائبٹیز، ہائی بلڈ پریشر، فیٹی لیور، اوبیسٹی، ہارٹ ڈیزیز کا خطرہ بڑھ جاتا ہے۔ اسلام نے 1400 سال پہلے ہی اعتدال کی تعلیم دی۔ کھانا شروع کرتے وقت بسم اللہ اور کھانا ختم ہونے کے بعد الحمدللہ کہے۔ نبی کریم صلی اللہ علیہ وسلم نے فرمایا، جس نے کھانا کھایا اور پھر اللہ کا شکر ادا کیا، اس سے اللہ تعالیٰ راضی ہو گیا۔ یہ صحیح مسلم کی حدیث ہے۔ اللہ اور ان کے رسول نے کچھ غذاؤں کی خاص فضیلت بیان کی ہے جسے ہم سنہ فوڈز کہتے ہیں، اور وہ ہیں کھجور یعنی ڈیٹس، جو ہمیں انرجی دیتی ہیں، فائبر سے بھرپور ہوتی ہیں، آئرن اور پوٹیشیم کا اچھا ذریعہ ہے۔ اور ہے شہد یعنی ہنی، سورہ النحل میں جسے شفا کہا گیا ہے، جو نیچرل انرجی دیتا ہے، گلا ٹھیک کرتا ہے، زخم بھرنے میں مدد کرتا ہے، جس میں بہت ساری اینٹی بائیوٹکس بھی پائی جاتی ہیں۔ اور ہے زیتون یعنی اولیوز۔ اللہ سبحانہ وتعالیٰ نے سورہ التین میں زیتون کی قسم کھائی ہے، والتین والزیتون۔ اور نبی کریم صلی اللہ علیہ وسلم نے فرمایا، زیتون کا تیل کھاؤ اور لگاؤ کیونکہ مبارک درخت ہے اس میں سے ایک ہے۔ یہ ترمذی کی حدیث ہے۔ ساتھ ہی کلونجی یعنی بلیک سیڈز، نبی کریم صلی اللہ علیہ وسلم نے فرمایا، کلونجی میں ہر مرض کی شفا ہے سوائے موت کے۔ یہ صحیح البخاری کی حدیث ہے۔ یعنی اللہ نے اس میں بہت سے فائدے رکھے ہیں، لیکن ہر بیماری کا علاج صرف اسی سے نہ ہو جائے گا، ایسا سمجھنا درست نہیں ہے۔ شفا دینے والا تو اللہ سبحانہ وتعالیٰ ہی ہے۔ ہم ان سب چیزوں کو اپنے ڈائٹ میں شامل کرنا چاہیے۔ اس طرح ہمیں اپنی پلیٹ میں پھل، سبزیاں، پروٹینز جو ہمیں دودھ، دہی سے ملتا ہے، کاربوہائیڈریٹ جو ہمیں دال، چاول، روٹی سے ملتے ہیں، ان سب کو شامل کرنا چاہیے۔ ساتھ ہی ساتھ مناسب مقدار میں پانی بھی پینا چاہیے۔ تبھی ہمارا کھانا ایک متوازن غذا یعنی بیلنس ڈائٹ کہلاتا ہے۔ تو آئیے جانتے ہیں ہم کیا ہے وہ سنہرا تیسرا اصول۔ تو تیسرا اصول ہے پانی کی اہمیت۔ ہمارے جسم کا زیادہ حصہ پانی پر مشتمل ہے۔ پانی جسم کو ہائیڈریٹ رکھتا ہے اور بہت سے فنکشنز کو بہتر بناتا ہے۔ اس لیے دن میں سے ہمیں کم سے کم 2 سے 3 لیٹر پانی پینا چاہیے۔ اور وہ بھی دیکھیں کہ پانی صاف ہو۔ اسی لیے دن بھر میں مناسب مقدار میں صاف پانی پینا چاہیے۔ کم پانی پینے سے تھکان، سر درد، قبض یعنی کانسٹیپیشن اور کڈنی کے مسئلے پیدا ہو سکتے ہیں۔ اور چوتھا اصول ہے حرکت اور ایکسرسائز۔ اسلام سستی کا دین نہیں ہے۔ چلنا، محنت کرنا اور جسم کو ایکٹیو رکھنا سننا ہے۔ ایون ہماری نماز میں بھی پورے جسم کی حرکات ہوتی ہے، صرف ایک جگہ کھڑے ہو کر یا بیٹھ کر ہم عبادت نہیں کرتے۔ آج ہم ڈاکٹرز بھی کہتے ہیں کہ روزانہ کم از کم 30 منٹس واک یا ہلکی پھلکی ایکسرسائز صحت کے لیے بہت مفید یعنی بینیفیشل ہے۔ گھر کے کام، سیڑھیاں چڑھنا، بچوں کے ساتھ کھیلنا یا واک کرنا بھی ایکسرسائز کا حصہ ہے۔ اور پانچواں اصول ہے اچھی نیند یعنی گڈ سلیپ، ہمارا فیوریٹ کام۔ کم نیند یا دیر رات تک موبائل چلانا صحت کو نقصان پہنچاتا ہے۔ ہمیں وقت پر سونا اور وقت پر اٹھنا چاہیے۔ فجر کے لیے اٹھنا اور دن کا آغاز اللہ سبحانہ تعالیٰ کے نام سے کرنا صرف روحانی نہیں بلکہ جسمانی صحت کے لیے بھی مفید ہے۔ اور چھٹا اصول ہے آج کل سٹریس اور انزائٹی عام ہو چکی ہے۔ اسلام ہمیں اللہ سبحانہ تعالیٰ پر توکل یعنی ٹرسٹ کرنا، صبر ہے۔ جب دل پریشان ہو تو قرآن کی تلاوت کریں، ذکر کریں، دعا کریں اور نماز کی پابندی کریں۔ اللہ تعالیٰ فرماتے ہیں، اللہ بذکر اللہ تطمئن القلوب، یعنی یاد رکھو اللہ کے ذکر سے ہی دلوں کو سکون ملتا ہے۔ ساتواں اصول ہے بیماری سے بچاؤ اور اپنی صحت کو اہمیت دینا۔ اکثر شوہر اور گھروں کی خیال اپنے سے زیادہ میں عورت کی جان اور صحت کو بہت ڈائبٹیز، بلڈ پریشر، تھائرائیڈ، انیمیا، برسٹ یا دوسری کوئی تکلیف ہو تو وقت پر ڈاکٹر سے مشورہ کریں. اپنی مرضی سے میڈیسن نہ لیں. ویکسینیشن اور میڈیکل چیک اپ بھی بہت ضروری ہے. صحت کی حفاظت کا حصہ ہیں. اسلام ہمیں اپنی جان کی حفاظت کا حکم دیتا ہے. 8واں اصول ہے اچھی صحبت اور پازیٹیو لائف سٹائل. اچھے دوست اور اچھا ماحول صحت پر بھی اثر ڈالتے ہیں. غصہ، حسد یعنی جیلسی اور نفرت، ہیٹریٹس انسان کے دل اور دماغ دونوں کو متاثر کرتے ہیں. معاف کر دینا، شکر ادا کرنا اور مسکرانا بھی صحت کے لیے فائدہ مند ہے. اسی لیے مسکرائیے، کیونکہ مسکرانے کسی کو دیکھ کر بھی صدقہ ہے، یعنی چیریٹی ہے. پیاری بہنوں، اگر ہم اپنی زندگی میں کچھ چھوٹی چھوٹی عادتیں اپنا لیں، جیسے وقت پر سونا، صحت مند غذا یعنی بیلنس ڈائٹ کھانا، روز واک کرنا یعنی پانی پینا، صفائی کا خیال رکھنا اور اللہ سبحانہ وتعالیٰ کا ذکر اور شکر ادا کرنا، تو ہم صحت کو بہت بہتر بنا سکتے ہیں. یاد رکھیے، صحت صرف بیماری کا نام نہ ہونا نہیں، بلکہ جسمانی یعنی فزیکل اور ذہنی یعنی مینٹل اور روحانی طور پر تندرست ہونا ہے. آخر میں یہی کہوں گی کہ اپنی صحت کو اللہ کی امانت سمجھیے، اس کی حفاظت کیجیے، کیونکہ صحت مند مومن اللہ کی عبادت بھی بہتر کرتا ہے، اپنے گھر والوں کا خیال بھی بہتر رکھتا ہے اور معاشرے یعنی سوسائٹی کے لیے بھی فائدہ مند ہوتا ہے. اللہ سبحانہ وتعالیٰ ہمیں صحت مند زندگی گزارنے، سنہ پر عمل کرنے اور اپنی صحت کا حفاظت کرنے کی توفیق عطا فرمائے. وآخر الدعوانا ان الحمد للہ رب العالمین. جزاک اللہ خیراً کثیرا. السلام علیکم ورحمۃ اللہ وبرکاتہ.
جی جزاک اللہ خیر ڈاکٹر ہاجرہ، آپ نے ہمارے ساتھ بہت ہی اچھی باتیں شیئر کی ہے. بے شک صاف صفائی، وقت پر سونا، جاگنا، کھانے میں اعتدال اور مسلسل ایکسرسائز سے ہم اپنے جسم کو صحت مند رکھ سکتے ہیں انشاءاللہ. Now proceeding with our health awareness session, I would like to invite our guest speaker for this afternoon. I would like to present a small introduction about her first. She has completed her MBBS from Ambedkar Medical College and pursued MS in ENT from Bangalore Medical College. She has a total of 19 years of experience in ENT and head and neck surgery. She has worked as an assistant professor of ENT for a cumulative period of 6 years, managing OP and operation theatre. She has also served as an associate professor and a guide for master students in MS-ENT at Rajiv Gandhi University of Health Sciences, Bangalore. She has operated and managed complex cases during the COVID pandemic as well. I would like to invite Dr. Minutha from Medex Medical Care Center, Fahil, Kuwait, to share with us the causes, symptoms, and treatment of hypothyroidism and hyperthyroidism. Yes, ma'am, over to you.
Good afternoon.
Good afternoon, ma'am.
Thank you so much, Mrs. Hina Parker for this vivid introduction. So you will be sharing this. Yeah. Okay. Thank you. So as everybody, Dr. Hajra Syed,
Ma'am, sorry for interruption.
Mentioned, nutrition is very important.
Ma'am, your voice is breaking. Sorry for the interruption, but your voice is breaking.
Makes the most of our diseases, as Mrs. Hina Parker, are thyroid disorders. So before going into thyroid disorders, I would like to
Ma'am, I'm sorry to interrupt, but your voice is
tell
breaking.
you what are the things I'll be introducing or talking to all of you people. So ma'am, next slide, please. Next slide. Audible?
No, ma'am,
Am I
your
audible
voice is
now?
breaking.
Can you hear me now?
No, ma'am, we can't hear you. You can just
Am I
try
audible now?
adjusting
I'm
your mic.
looking. Hello? Hello? Am I audible?
No, ma'am, it's breaking. It's still breaking and echoing also.
1 minute. I'm going to join from another.
Yes. Yes, sure.
Am I audible now? Now am I audible?
Yes, now we can hear you.
Yes, now you are audible.
Is it very clear? Is it very clear?
Yes.
Okay. I have joined from my husband's account. Okay. So today's talk will be on thyroid disorders, as we all know. So before I get into the topic, I just want to brief everybody what am I going to talk about. So I'll talk a little about the anatomy, because all of us should be aware where the thyroid gland is present. As a normal, as an individual, we should know where the anatomy, we call it in a medical term, where the gland is situated, and when all you have to visit a doctor based on this conditions. That is hyperthyroidism or hypothyroidism. Hyperthyroidism, it is a little technical term. In normal words, we can say, whenever there is a swelling of the thyroid, or when there is increased amount of thyroid hormone in the body, or whenever there is reduced amount of thyroid hormone in the body. How do we know whether it is increased or reduced? We will know by the clinical features. Clinical features means the symptoms, whatever we all suffer from. Either, it's like something which we all feel something is abnormal in our body. So that is when we go to a doctor. When we go to a doctor, normally what happens? We do certain tests. Based on that test, then we are all aware, okay, what is it? Okay, this is what I'm briefly I'm going to talk about, and a little, brush up on the treatment. So it is like overactive thyroid or underactive thyroid. The next slide, please. Next slide. Yeah. The coming to location of thyroid, as I've told you, it is in the lower part of the neck. Okay. So it is, all of us know there is one prominent structure. When you look up and you just, keep your finger, you have something very prominent. See, that is not thyroid. In the center, you have to go a little below that, and you feel a soft structure just beneath it, it's about 3 centimeters below the prominent structure is the thyroid gland. So what is this? How the thyroid gland secretes the hormone? A little briefly, I'm going to tell you. It is like there is a structure called a hypothalamus in the brain. And then there is one pituitary gland. Imagine the hypothalamus is like a father in a family. The thyroid gland, the pituitary gland is like a mother in the family. And a thyroid gland as such are like children. So what happens? So normally the father will tell the mother if children have to do some activity, or if they're not performing properly, the father will tell the mother, and mother will execute the work. she is the person who goes and tell, okay, you're not doing something, so for which you have to work. So that is like, passing on the message to the children in a way that they can perform better. So that is like thyroid gland is like a children, and output, whatever children do, that is hormones like T3, T4. This is just, for a understanding purpose. I thought let me make it like a family so that you can understand the um, physiology of the hormones. So it's like father will tell a mother, mother will tell children, and children will work and bring out the best whatever they can do. It is like studying or going for activities or eating. These are all the performances done by the children. So the performances are like a thyroid hormones. So whenever children are performing well, that is like the hormones. Hormones are nothing but T3 and T4 from a clinical point of view. So many of us, are aware of thyroid hormones. People who are already having a thyroid diseases, they already know what is T3, T4. Hello? Am I audible? Hello?
Yes.
Am I audible?
Yes.
Yes,
So
yes, you are
these
audible.
hormones,
Yes.
when these hormones are in normal condition, when the children are doing activities, normally a father or a mother will not, think too much about the children. So they are doing normal activities, so everything goes in a flow. The same way, even if the thyroid hormones are normal in an individual, the hypothalamus and the pituitary gland will have a negative feedback. That means they keep doing a routine activities. So there is no impairment. So when these hormones will come into a picture, that is like a activity of pituitary gland, that is TSH. Normally, whenever a patient goes to a doctor, we always ask for thyroid TSH and T3, T4, and we look for those dearrangements. So these dearrangements, any dearrangement in this thyroid hormones, we know that, okay, whether the patient is having a hypothyroidism or hyperthyroidism. That is when T3, T4 levels are very high and TSH is less. So usually when does that happen? As I've compared this to a family, the output of a children, that is T3, T4, if it is high, we parents tend to, not tell anything to children. We just say, okay, go ahead and play, and we just keep quiet to ourselves. Sometimes when they are very active, children are very active also, we just take a back seat and we will not, tell them anything. So that is what happens in this. In case of hyperthyroidism, what happens? The TSH will be very low. When children are not performing well, that is hormones, T3, T4, when they're not performing well, we put more pressure. That is like TSH. TSH is mother is telling the children, you have to work hard, work hard, work hard. So then TSH, the pressure is high. So in case of hypothyroidism, the TSH level will be high. So this is a small, just which I felt like, let me relate to the family so that all normal people can understand in a language they understand. Okay. So T3, T4, TSH, these all act in a cycle. Next slide, please. Next slide, please. Miss Hina, next slide. Yeah. So why is this thyroid hormone so important? So because it maintains the normal function of all the organs in our body. So basal metabolic rate. See, basal metabolic rate is nothing but a normal function of all the cells which consume oxygen and produce heat. So the normal function of the cells require the presence of thyroid hormone. And about heart also, if it is beating normally also, we need a normal thyroid hormone range in the blood, and which is also required for the growth of an individual with the neural activity for for an individual to have a good senses of everything, and to think intellectual level, memories, and, in case of increase in growth, we need a muscle. So for muscular growth and for the normal GIT, gastrointestinal tract activity, for whatever we eat, the stomach has to absorb, the stomach, intestine have to absorb the nutrients, and the gut motility, after absorption, the formation of the stools and all the activity of the gastrointestinal tract has to be normal, means the levels of thyroid hormones should be normal. So thyroid hormone plays a great role in the normal functioning body. The next slide, please. So let's talk about, okay, so as I've told you, for the normal function, the thyroid hormone should be normal. Let me talk about few words on hyperthyroidism. Otherwise, it is called overactive thyroid hormone. So when do we know that we have hyperthyroidism? Without doing a lab test, so at home, we need to have these symptoms to say that we have hyperthyroidism. What is it? First of all, what do you notice? You will have some fever. You will have some fever. That is what normally the patient relate to. And they will say they have pain in the neck. They will have a swelling in the neck, or they can come with the complaints of swelling in the neck, or they might have the following symptoms, which I'm displaying it on the screen. So weight loss. What do you mean by weight loss? So we all, do exercise and go on a diet to lose weight. But doing this and losing a weight is a healthier way. So unintentional weight loss, that means though you're eating well, though you're not on a diet, you're eating everything, still you feel, okay, oh, I'm losing weight. So then something must be wrong. See, the thing is, we have to realize something is wrong. That is when we have to go to a doctor. So when you have to go to a doctor, this is a condition. You're eating very well, you're not on a diet. I mean, you know what is fat, what is carbohydrate, and what is the protein. Yet, without even thinking, you're just eating, yet you're not putting on weight. You're losing weight. Yes, this is a condition. You have to go for a doctor. Not only that, tremors. What do you mean by tremors? When you stretch your hand, it's shaky. When you hold a plate, you feel shaky. Spoon, you're not able to eat. You have little tremors. So that is when, you have to think, okay, this might be a condition. Sometimes even when you are anxious, and anxiety also you will have tremors, but that is different. There you will not have a fine tremors. Tremors is shaky hands. Whenever you're trying to eat or anything, you know that this is something abnormal. So that is when you can think, okay, fine, it is the time to go to a doctor and get a thyroid hormone tested. And next, coming to heat intolerance, sweating, excessive sweating. Though you're sitting in a AC, you start sweating, which is not just 1 day or 2 days. You feel, okay, there is some abnormality where everybody are comfortable, but still you feel, okay, I'm sweating, I'm not able to tolerate. Probably I need to reduce the temperature more. So this can be even in case of hormonal imbalance, also not only associated with thyroid, also in case of perimenopausal and menopausal ladies will also experience this heat intolerance. So it's not only one condition which makes you to think, okay, this is thyroid hormone. There is 2-3 factors which is, there in your mind. And when you succumb to all these symptoms, it's better to go and test for a thyroid hormones. Other symptoms will be palpitation. Palpitation means increased heart rate. Though you're sitting in one place, but your heart is beating, not because of what's happening right now, the condition here, but otherwise also you're just sitting. You want to be peaceful, but still your heart rate is increased. Even in those cases, you should think, okay, fine, it's time to get a thyroid hormone test. Then sometimes what happens when you look at the person, you feel they are staring at you. Normally, you will not see that staring eyes. If you see a staring eyes, yes, it's time to evaluate your thyroid hormones. Otherwise, psychologically, emotionally, you're very irritable. You feel, okay, something is wrong. You get anxiety. You become anxious about few things. You don't want to listen to certain things. So these are all the features of hyperthyroidism. Apart from that, skin conditions like, you might be losing your hair loss, then pigmentation. Pigmentation can be, hypopigmentation, or in case of white patches in your body, you might start seeing, or in case of, wet hands, hyper secretion of sweat glands. It's always wet. Your hands are always wet. And one more thing, increased thirst, and you see a swelling in the leg, or you are, dyspneic. Dyspneic means breathlessness. You're not able to, though you're sitting, you feel your breath rate is increased, breathlessness, and diarrhea, vomiting, or even in case of, hyper increased frequency of visiting a toilet, that is diarrhea. Okay, normal form stools, but still you want to visit. If you're going to, increase number of stools, that is also a condition where you can think of hyperthyroidism. And in coming to reproductive things, also the few individuals might face amenorrhea, that is like having a periods for, postponing, like more than 2 months or 3 months, or in case of infertility, in case of spontaneous abortion. These are the conditions where you have to think about a thyroid disorders. So next slide, please. So as I mentioned, all these things, yeah, one more thing is insomnia, sleepless nights. That is also a condition where, you can suspect a thyroid hormone disorders. Next slide, please. So what is hyperthyroidism? As I've already mentioned earlier, so increase in a thyroid hormones. Increase in a thyroid hormones, that is T3, T4. That is what we look into it. And with the syndrome of the symptoms, whatever I have told, with a diagnostic test showing a increased T3, T4, we call it as a hyperthyroidism. The next slide, please. Very commonly, what you see is the clinical term of Graves' disease is related to hyperthyroidism. So how do you get this Graves' disease? As the picture is showing, there is a swelling in the center of the neck. So when do you get this? This can be post-viral infection. This can be post-bacterial infection, or it can be autoimmune disorder. Autoimmune disorders, this is very commonly, it's associated with rheumatoid arthritis, or in case of celiac disease. What do you mean by this? In rheumatoid arthritis, the other joints are also affected. Already patients who are diagnosed to have rheumatoid arthritis, they have a chance of having a hyperthyroidism. And patients with celiac disease, because of autoimmune causes, even they tend to have the swelling of the thyroid. And post-viral, post-bacterial, and inflammatory antibodies which are present, post-inflammatory antibodies which are present, they act as thyroid hormone receptors. They stimulate the thyroid hormone receptors to increase the secretions of the thyroid gland. So what I'm trying to tell you is, mainly after a viral infection or bacterial infection, or anybody who is diagnosed to have rheumatoid arthritis or celiac diseases or any autoimmune diseases, it's better to evaluate your thyroid hormones to know whether you, with the clinical symptoms which I have mentioned prior, to get your thyroid hormone assay done. So in this, you can have a swelling. You might notice the swelling. You might not notice the swelling. Yet it is, when you have a symptoms, it's better to visit a doctor. So what are the causes? I've already mentioned: inflammation, and also excessive usage of antithyroid medications can also give rise to hyperthyroidism. Next slide, please. So this is what I was telling you. When you look at the patient and the patient is staring at you, this look, if you see, it is better to tell the patient to get the thyroid hormone investigations done. So as I've told you, this will not be just because of a thyroid hormone increase in the body. This will be because of the immunoglobulins. The immunoglobulins means antibodies which are present in our body. They stimulate the thyroid gland to secrete more of thyroid hormones, giving a picture of hyperthyroidism. The next slide, please. So the little, I thought to give an emphasis for the patients who are, prone for relapse. Relapse means though you give a treatment, they keep getting, once you stop. Or the patients who are going in for Graves' disease. That is the typical characteristic which I have mentioned. The most commonly, it is males less than 40 years who are already having hyperthyroidism. They tend to have recurrences. So they will have a repeated episodes of hyperthyroidism or a goiter. In normal terminology, most of us know a term called goiter. That is swelling of the thyroid gland. So in these cases, there will be increased amount of thyroid hormones, and there'll be increased, there is a specific investigation which we do for Graves' disease that is called TSH receptor antibody level. These are very high in case of Graves' disease. The next slide, please. So this is about the lab investigations, which I want to just highlight a little. So thyroidism, hyperthyroidism, the lower level of TSH, that is what I told you, as mother, if mother will not say anything, children are performing their activities. So that is like thyroid hormones being high, activities high, and mother not, telling the children to perform. That is hyperthyroidism. Subclinical means the patient will have a normal thyroid hormones, but TSH level will be low. In these patients also, we need to wait and see. It's like, if it is very low, we tend to treat a patient, but these subclinical hyperthyroidism patients need to visit their doctors for further evaluation and a treatment. And there is, as I've told you, there is the head also, in the head, that is the pituitary gland. If there is any deficiency in the pituitary gland, because of which the thyroid hormones are elevated, this can be diagnosed again by looking at the thyroid TSH levels and the hormones. The next slide, please. So how do we treat a hyperthyroidism? See, this is one, clinical practice which we really bent upon looking into, okay, what is the treatment modality? So for a treatment modality, first of all, we need to know what is the cause. As I've told you, it can be because of the nodules which are present, or it can be because of the, medicines what the patient is taking, or it can be because of the temporary. It is usually seen in case of puberty goiter. Puberty goiter means, or during a pregnancy. During a puberty means because there is an increased need of hormones in an individual. When the individual attains a puberty, because the growth spurt is so high, they need hormones. There's an increased amount of hormones for which the thyroid gland will work more beyond the capacity, because of which the thyroid hormone will increase in size. So which is definitely physiological. And also during a pregnancy, the thyroid gland will increase because of increased demand. So these are all physiological, which can be just, wait and watch. This is the protocol, just wait and watch. For others who have a big thyroid gland, who need to be treated, we look into many conditions before planning for the treatment of the patient. First, we'll find out the cause of it, then the preferences of the clinicians, whether some patients they don't want to do a surgery because they don't like the scar. Some patients are okay to do a surgery. So it is a preference of a clinician and patients. Then the risk and benefits of the treatment. So there are many contraindications for doing a surgeries. Contraindications means not, that is not old patient who cannot tolerate the surgery. So these are the people who would prefer to go in for the tablets. So what are the main thing which I want to tell you is conservative means patients not going in for surgery. Who are the patients who want to go in for tablets? That can be decided by talking to a doctor and the preference of the patients, what they want to take. Antithyroid means it's a long-term cure rate. And there will be certain side effects of the medications, which I'll be talking to you in the later slides. And radioactive iodine also, it is a process where, the patient have to be dependent on a treatment. And usually if the patient is planning to conceive or going for pregnancy, they are all not exposed to radioactive iodine. And coming to surgery, yes, again, they have to go in for lifelong treatment because they will have to be dependent on a synthetic thyroid hormone. And there is a risk of hypocalcemia. There is a risk of injury to the nerve. There is a scar, and the anesthesia and the surgical complications are other set of complications which will be dealt differently. So these are the things which a patient will be aware before going in for the treatment of a hyperthyroidism. I hope I'm making it as simple as possible. I hope the crowd here can understand the language in which I'm speaking. The next slide, please. So as I've told you, the treatment is medicine where the patient can take it regularly, or a radioactive iodine, which I have mentioned previously. And the beta blockers is again, these are the medications, these are called the supportive medications, which are given to suppress the symptoms of an individual. The next slide, please. And the side effects briefly about the antithyroid drugs. The side effects which you can, just brush it off are rashes. Sometimes the patient can have a fever, mild fever, which can be transient. There can be urticaria, that means itching. After you take a tablet, you might have a itching or you might have a joint pain to little extent where you can just take painkillers or paracetamol and you can brush it. Yeah, these are the symptoms which can be brushed off. When you have a serious conditions like, pain abdomen or, weakness, where the lab investigations gives other, parameters elevated, that is when we have to stop on antithyroid medicines and go in for the surgical aspects of the treatment. The next slide, please. Next slide, please. Yeah, the indication of surgery, it is large thyroid, as I've told you. Then when we suspect malignancy, yeah, malignancy is a very important thing, which I'm not stressing much because nowadays we are all aware whenever we have a symptoms, as I've mentioned prior, it's better to go to a doctor. We do investigations, then we do FNIC, and we know, okay, this patient is going in for any, turning, looking something very big. So definitely the indication for thyroidectomy. That is the removal of a thyroid. The back slide, please. The last slide. Yeah. Especially when a suspicion of a malignancy. And yeah, pregnancy also, we give antithyroid drugs, but when the symptoms are very severe, we do go in for surgery. The next slide, please. So there is something called thyroid crisis, means you neglect the symptoms and you prolong with hyperthyroidism, where you don't take a medications, you don't go in for any of the treatment, you tend to neglect, then you can end up in something called a life-threatening emergency called a thyroid crisis, where the fever is beyond the control. You'll have a heart rate, palpitation, agitation, delirium. Patient is not conscious of what he is doing. So sometimes what happens, even if the patient is having a thyroid condition, and if he goes for any infection or any trauma or stress, again, they can go in for a thyroid crisis. This is just for the awareness that there is a condition, something called a thyroid crisis. The next slide, please. So that was about a hyperthyroidism or hyperactive thyroid. So now let us talk about hypothyroidism, which is very common, very, very common. At least we get to see about three to four patients in a month. And this has become a very common condition in Kuwait, especially, not only Kuwait, even in India. The very common thyroid disorder, what we see is hypothyroidism. Hyperthyroidism, somehow it will be evident. Hypothyroidism normally goes unnoticed. So I think all of you should be aware when to visit a doctor in a underactive state of thyroid hormones. The next slide, please. So as I've mentioned, at least 5% of the population, very commonly seen in women and elderly, when I say it is more than 60 years, where the body's demand needs extra attention. Okay, so what is it? When a thyroid gland does not produce adequate amount of thyroid hormone to meet the body's need, the slowing down of the thyroid gland is a condition where need to be treated adequately. The next slide, please. So in India, briefly, I just want to show you this picture to make you aware where all there is a iodine deficiency because of the climatic conditions, which is much away from the coastal areas. As you can see, this the upper north and east area is more prone for hypothyroidism. And as you come to south, as it's close to the coastal area, it is much lesser. So this picture depicts the areas with the iodine deficiency conditions leading to thyroid disorder and mainly hypothyroidism. Next slide, please. Next slide, please. So what are the causes? Yes, very important is what are the causes of hypothyroidism? So normally, it's something called congenital. When the child is born, they might have an atrophic thyroid, where the baby has lost the capacity to produce a normal hormones. So this is called congenital hypothyroidism. Or in case of, as I've already mentioned, in case of surgery, post-surgery, iodine treatment, or in case of iodine deficiency, as I mentioned, or in case of patients who are on antipsychotic medications. These are all the patients who are prone for hypothyroidism. The next slide, please. Okay, and again, as many of them today's speakers, they have mentioned, Dr. Hajira also mentioned about the balanced diet. So who are the patients who are more prone for hypothyroidism? Patients who are having the sedentary lifestyle, who have a poor sleep habits, who are under chronic stress or post-stress, extreme dieting, increase the exposure to toxins, caffeine intake, smoking. These are all the conditions leading to a hypothyroidism. The next slide, please. So once the patient is diagnosed to have a hypothyroidism, so it is better to avoid goitrogenic vegetables, because they reduce the they reduce the absorption of iodine, and they interfere with the production of a hormone. So what are the things? Goitrogenic vegetables like broccoli, cauliflower, kale, Brussels sprouts. These are the things which have to be reduced. They should not be eaten in a raw form. They can be cooked and eaten as a balanced diet. The next slide, please. So what are the things which need to be avoided? Any food which causes a inflammation and a weight gain, because it hinders the formation of the T3 conversion. Because as I've told you, any highly processed foods or excessive sugar, it acts as an inflammatory markers in our body, which increases the inflammation. So most of the gluten diets like bread, pasta, and cereals, they all increase the autoimmune disorders in the body, causing a deranged thyroid hormone. Next slide, please. So other things which need to be avoided are soya products, because they inhibit the synthetic thyroid hormone, especially where people are on liver L-toxin, synthetic thyroid hormone replacement. Should be careful when taking these processed food and soya products. The next slide, please. Next slide, please. Hello. Hello. Am I audible? The next slide,
Just give me
please.
a minute.
Yes,
No
ma'am, you're
problem. No.
audible.
Yeah.
Nata is just
Okay.
trying to get the slides in place. Yeah.
Okay. See, basically, we all know what we have to eat, what we shouldn't eat. All of us know. Only thing is we have to put it into practice. That is all. So a little about scientific knowledge about what is Hashimoto's thyroiditis. As I've told you, this is nothing but autoimmune destruction of the cells. And, these are all, whatever I'm talking, like, the markers, the investigations, these all are done by a lab investigations. So in thyroiditis, it's like a double-edged sword, where you can either have a hyperthyroidism or hypothyroidism. So that is why we need to evaluate with the diagnostic tool, that is T3, T4, TSH, anti-TPO levels. These are all the things which we need to do. The next slide, please. So what are all the symptoms the patient comes to us with hypothyroidism? So whenever you feel fatigue, means lethargy, you don't feel like doing something, you just want to take rest. Though you take rest, you're not happy with it. You just want to continue doing the same. You just want to sleep. You don't feel like, getting up and taking an initiative. You tend to have a weight gain, depressive mood, not, comprehending. When somebody comes and tells you, come, let's go out, you'll be like, no, let's do it later. So these are the things, which should make you think, okay, fine, there is something wrong with me. It is not because I'm sitting, I'm tired. So this is the time you have to go and get a thyroid investigation done, like cold intolerance. Everybody are sitting normally with the room temperature of 25 degree, yet you feel, oh, it's very cold. So these are the symptoms which I have mentioned here. The brittle skin, the dry skin, these are the hoarseness of voice. Yes, and again, the change in voice. This can be because of hypothyroidism as well. So the next slide, please. Yeah, whatever I mentioned, the same thing in a pictorial picture. You can see, and when you have a brain fog, or you feel your heart rate is a little slow, you're feeling weak, your face is puffed up. So this is a time where you have to evaluate yourself with the thyroid hormones. The next slide, please. The same thing, which again, the edema means swelling of the hands, feet, and all. needs to be evaluated. And when you're talking, your speech is changing, the voice is changing. So you need to evaluate with the thyroid hormones. The next slide, please. The same has hyperthyroidism. Even hypothyroidism can be subclinical, where a patient is doing everything normally, but they are a little lethargic. And when they get a lab investigation, their TSH will be elevated. This again, the treatment depends on how the clinician, with their experience, they will suggest you whether to start with the treatment or we can just wait and watch. The next slide, please. So all of us know whenever we have a hyperthyroidism, we do start on a synthetic hormone, that is the levothyroxine therapy, which is the synthetic T4, which has to be taken in an empty stomach with a water, which should be at least 30 to 60 minutes prior to the first meal of a day. So we have to monitor initially at least for about 6 to 8 weeks after starting the treatment. After which, we can check once in 3 months for the first year and then annually. And the doses are adjusted according to the body weight and according to the response of an individual for the treatment. The next slide, please. The supportive tips and the precaution which has to be taken while taking medication is, if you're taking any conflicting foods, which has a iron calcium content or iron content, so it has to be taken, or medicines, supplements, if you're taking like iron and calcium supplements, which the gap should be at least for 4 hours after taking a thyroid hormone. And the cooking, steaming will reduce the goitrogenic level of the food. And weight management, exercise, as already Dr. Hajira has mentioned about exercise, balanced diet. So these are the things which helps to maintain a static thyroid hormone levels, and definitely to consult a professional for any needs. Any problem when you're taking medications or you're not feeling comfortable with the dosage, not happy with the treatment, you should always consult a professional for help. So another things which helps thyroid patients is a supplementation with the zinc, iron, and selenium-rich foods like seafood, lean meat, and nuts. These are all helpful for maintaining or sustaining a normal thyroid hormone in the body. And to avoid anti-inflammatory foods like, the juice, the sugar, or, these are the things which you have to be avoided, especially the strawberries, the peaches, and they reduce the stress in the body and support a gut health by eating a lemon, tomatoes, spinach, the healthy food, which promotes the absorption and the rich content of zinc and selenium. The next slide, please. Yeah. Iodine-rich foods, like, as it's shown in the picture, the dairy products, it will help for the increased iodine and calcium, which is essential for normal. Okay, then last word about myxedema coma. Myxedema coma, it is called if the patient is untreated. Again, as I mentioned about the thyroid crisis, this is the final stage where the patient will have a unstable mind and they will have a severe hypothermia, feels very cold, and again hypoventilation, and the patient will be unresponsive. So there is the extremes in both the conditions. So that is why what I would suggest is, whenever anybody has 3 to 4 symptoms of what I have mentioned already, kindly visit a doctor or get a thyroid hormones tested and take adequate treatment, and so that to have a happy individual. and stay happy. So this is the last slide, which compares both the hyperthyroidism and hypothyroidism. I hope this will summarize what I have spoken until now. So that is like hormone levels, the high and low, and common causes, the general causes, the symptoms, which I've already mentioned, and the diagnostic test, which has to be done in the hospital. This is the same thing, which is summarizing what I have explained already. Yeah, now I'm ready to take questions. Anybody have any questions? So thank you. So thyroid health is a balance of metabolic signaling.
Yes. Thank you, ma'am,
Good,
for shedding light
good
on this
afternoon.
topic.
Yeah, good afternoon. You tell me.
I would like to ask
Hmm?
a question. What is
Hmm?
antithyroid? Having multiple nodules, and you can see me the way I'm speaking now. I'm the
Yeah.
victim. I'm this one of this. I'm a patient of this. So
See, as I've mentioned, see, if there is multiple nodules, there are two things. It's like if there is the change of voice can be because of many things. I can't just tell you like this. If you're on anti-thyroid drugs, if you're not worried about how you appear,
no, I'm not
but the
taking any
thyroid
drugs
hormones,
for that.
you're not taking any anti-thyroid hormones.
No.
Okay. You have a multinodular goiter.
Yeah.
You have been diagnosed. Okay. And
Yeah,
your
I've been
thyroid
diagnosed
hormones
with
are
that.
normal. Hmm?
Yeah, everything. I have been diagnosed with that, and I went to the test also. Then they have said that the multiple nodules are there, but it's not to be worried now. But in India, when I have shown that, then they said it has to be removed. So should I go for the removal, or it is I have to go with this?
See, ma'am, that is what I told you. No, any treatment and thyroid, it is both the party, like a clinician and the patient. You both have to know what is the purpose of going in surgery. That is the main thing.
Yeah.
Mainly, is
One
it
doctor
because
is
of
advising
cosmetic?
for this, and one doctor is not advising for that. It's like that.
First, you have to do a FNAC. Investigation, FNAC, you know that injection they do for a thyroid, right? Are you aware of it,
Yeah.
ma'am? Yeah, we have to do that.
The needle
And then
test, I have
see,
gone to
we
the
have
needle
a
test.
grading. You got?
Needle test, no? Needle test for the nodules.
Needle test, yes.
Yeah.
In that have they mentioned there is a grading. You know, we have a grading. So we know that with the grade we can say, okay, we can wait and watch. But again, we'll ask you to grade again. When we do FNAC, because only problem with keeping a thyroid like this, I'm not scaring you, but you know, it might turn out to be something very big. Okay. So that is why we would suggest, but until unless we do FNAC, we are not sure what it is. See, just to keep a swelling, keep getting your thyroid hormones tested, do an FNAC. If everything comes out clean, then you can still wait and watch. The moment you feel we have a grading system in FNAC. Once we do needle test and follow with ultrasound, you have to do a follow with ultrasound and FNAC. We have a bigger picture as with a pathologist, and we being experienced with this, we can come to a conclusion whether we have to leave you like this or better to go in for surgery. So everything is methodical. It is a methodical process. If the size is increasing or reducing, if the FNAC is showing any changes, the stages are going up, then definitely you're a candidate for surgery. Yeah, I'm getting a
Okay.
question about the weight loss. Yeah. See, weight loss, first of all, it is, yeah, hormone as such is correct. And the hormones means hormones, other hormonal conditions. Like if you are in a perimenopausal state or you are in a menopausal stage, see, as such, as I've mentioned, thyroid hormone is required for a basal metabolic rate. See, these basal metabolic rate means the body's function to be normal, optimum level. Not only this, the hormones like estrogen, progesterone, all these and cortisol levels. So these are all the hormones required for maintaining a weight in an individual. So if you have a stress, if you have a stress in the body, the cortisol level increases the fat deposition. Okay. So the very important thing to reduce the weight is balanced diet, exercise, stress, managing your stress. Then what age you are in, like whether you are in a perimenopausal age or a menopause. So our basal metabolic rate reduces when we are in a perimenopausal or menopausal age. So it is better to meet a doctor. Better to meet your doctor and discuss. Definitely you will be able to get a outcome. Whether, your sleep is a must, at least 7 hours of sleep. Timing of your food is also very important. Very important thing here is stress. See, all of us know about what we have to eat, but the thing is, are we managing it regularly? Everybody are stressing upon it. All practitioners, whether it's homeopathy or whether modern medicine doctors, we always stress on a balanced diet and a healthy mind and a peaceful sleep. So these are the very important things for weight management as well. Any other questions, please? This is what somebody is asking when TSH is high and normal. This is something called subclinical hypothyroidism. That's what I mentioned in my slide. What is subclinical hypothyroidism? It is like normal level of T3, T4, but high level of TSH. Definitely you have to see a doctor based on how is your thyroid appearance and all, and they will be able to tell you. Not only TSH, they will look into other symptomatic conditions and need to be treated. And my TSH is in range. One. The other questions which I'm seeing is TSH is. You have to do something called a free T4. Okay. And do you have? One minute. I'm going to tell. My TSH is normal T4 range. So we need to see your thyroid also. We have to do an ultrasound. Ultrasound and FNAC will guide us the treatment. Sometimes I feel very hot, sometimes doesn't like to get out of the bed. My skin is also dry. Yes, ma'am, as I mentioned, because of the age, age also, you will be in a menopausal age. You are in a menopause or perimenopausal age. So you will have a symptoms of, all this hormonal imbalance. So you have to look into it and please get a thyroid levels done and meet a consultant. Any other questions? So I think I can conclude my session. Before I conclude, I would like to thank our Forum of Indian Doctors, Dr. Raghu, for giving me an opportunity to be a part of this beautiful, August gathering of IMA. Thank you very much. I hope I'm able to, make you understand a little of, thyroid disorders. If you have anything, you please contact the organizers and can reach me out.
Okay, ma'am. Thank you. Thank
Thank
you for
you. I
shedding light on.
also thank the organizers, Mrs. Shahnaz Fatima and Hina Parkar, and very good information from Dr. Hajira Syed, who made my work also easier by talking about a balanced diet. Thank you so much.
Thank you, ma'am. Thank you. Thank you for everything. Thank you for shedding light on this topic. And with this, we come towards the end of our session. But before we end, I would like to thank our guest, Dr. Minutha, for giving her valuable time and sharing such important information with us. I would also like to thank IMA Ladies Wing members for organizing this session. Yes, sorry. I would also like to thank IMA Ladies Wing and Forum of Indian Doctors Kuwait for conducting this health awareness session. And I would like to thank our audience also for making time and contributing towards the success of this session. I hope that it has encouraged us to make more healthy choices every day. Now, I would like to end the session with the supplication. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك. Thank you all. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.